Hello, everybody, and welcome to yet another episode of the Lumière Learning Monday. We are on season 5, episode 17, and it gives me absolute delight to bring my friend and someone I've admired for a very long time, Vasumathi Ganesh, who's going to come and talk about her journey in building QMed and a very unique path that she's chosen and is doing her wonderful work and continues to do work and inspire lots and lots of medical and healthcare professionals. So, welcome, Vasu.
Thank you.
So, Vasu, yours has been a very unique journey. So, our listeners, you know that we bring remarkable people to this show and people whose pathways have been so stellar. So, tell us, Vasu, about the early days. You started your education and then you pivoted after marriage and you interrupted your career at that time and then restarted.
Right. So I did my schooling in the KV, Kendriya Vidyalayas of IIT Bombay and then IIT Madras. While in Bombay itself, I developed a great interest in biology and specifically the human sciences. So my dad, who was a professor, was all encouraging that I should do medicine. Unfortunately, he passed away when I finished the seventh standard. Then we moved to what was Madras, where my grandfather, a famous economist, encouraged me, saying, yes, you should do medicine. But again, unfortunately, 2 years later, he too passed away. And it was in my grandmother's and mother's hands. So typically, as in those days, it was no, finish your graduation and get married. We need to have see you settled. So I understood the situation. It was a little tough. So I agreed. But I chose to do my graduation in home science. I had seen two senior girls in the family do it and got inspired. But more importantly, I realized it had the subjects related to medicine, which was physiology, nutrition, microbiology, child development, and so on. So that was the nearest, and I said, let me at least study that. I did my degree in home science, and my grandmother worked it all out. So I got engaged right in the middle of my final exams, got married 3 months later. I was okay. I was all ready for a homemaking thing because I'd seen my mother, grandmother, aunts all going through that. And in the 1970s, that was more or less the norm. Less number of women went out for a job. But somewhere down the line, I think unconsciously first and then later consciously, it started rubbing off that I felt I should do something outside the house. I
Mhm.
was still a homemaker for 12 years, but in between, I had done a 1 month stint as a telephone operator, and then I had done an almost 1 year school teaching job. After which, I thought that, okay, maybe I should get back to teaching because even as a youngster, I used to teach my younger cousins and my aunts. Everybody said, you're a very good teacher. I just thought, I'm teaching them what I know, what's great about this. But when I taught in the school, I felt, okay, yes, I am good at this. I should get to teaching. I wanted to do a B.Ed, but that had its own challenges. I would have needed 3 years to do that. And
Mhm.
then I said, okay, I came across this degree in library science, which was for 1 year. I said,
Mhm.
let me do that. Studying after a gap of 12 years and having brought up two children who were still in primary school was a challenge, but I was all ready for it. Of course, within a few months, it started getting tougher and tougher. Then, luckily, my whole family helped out. My husband's always been 1000% supportive in everything I do. My in laws came over for a while. Then, my mother came and stayed with me for 5 months. I managed to sail through that degree. And then I did three jobs. The first was in an institution related to physics. And then I found that I could get to the love of medicine by joining a medical library.
Mhm.
So I happened to see a job availability in Hinduja Hospital, worked there for 3.5 years. And I think I loved every minute of working there. But end of 3.5 years, I realized that in a private institution, a librarian isn't valued too high. This by the system. The doctors always put me on a big pedestal because that was the time when computers started coming into the profession. We had a database which used to come with updates every month on CDs, and I mastered it thanks to the training I had in library sciences and the efforts I put in. So I could help people with what kind of information they were looking for, and I would teach them to use it. So my teaching skills came back into vogue there. End of 3.5 years, I felt I'm meant for bigger things. First, I took up another job because those days that was the only way out. And this was at a very interesting library set up by a doctor couple under a trust. It was called Health Education Library for People. This one, it was still pre internet days, and it had an absolutely wonderful collection of books, pamphlets, magazines, CDs, etc., on all kinds of topics related to health and medicine, from the simplest of health, like good health, to complex diseases, but completely aimed for the layperson. So it was something very, very unique. I took over that one and enjoyed setting it up and having people come ask for help. While I was there, internet access became public. That was in 1995. So I started searching online and giving people the kind of help they needed. Couple of interesting examples. In Hinduja Hospital, we had the case of a police officer who came in with all kinds of scary symptoms. And the ICU doctor had a suspicion that it was thallium poisoning. So he came to the library and said, can we search for that on the CD database? And we found a case which matched exact symptoms. Then they could take the necessary action, get the necessary antidote, and treat him, and he recovered. Similarly, in Health Library, there was a doctor who called me and said, I have a newborn son with a very unusual condition. I have all the medical stuff, but I want to know more about support groups for this. So I searched online. There was no Google then, it was other kinds of searches. And I gave him a couple of addresses abroad. And then he called me to say, I've contacted them. They said they've asked me to start a support group in India and they've promised all kinds of help for that. So these were all very, very satisfying incidents of how I could use my skills. After these two, I again felt that I needed to do something much bigger. I started off as a freelancer, helping different doctors with different needs. Then different people told me you better at least establish a company, so which is what I started with. We did all kinds of work which not just related to the kind of help that I gave people earlier, but by the time I could do things like finding methods of getting doctors full text journal articles, which used to be a
Mhm.
challenge then. So a whole lot of services. I started helping small healthcare, not even small healthcare organizations develop their first website. Of course, this
Mhm.
is in collaboration with web developers. So I've done all kinds of things. But somewhere across the line, I figured that the searching was my biggest skill, and it was a skill badly lacking in India amongst health professionals and in their curriculum. So 2007, after a lot of trial, error, deliberations, we set up the trust called QMed Knowledge Foundation. The official name is Quality Medical Knowledge Foundation, but we always had the abbreviation QMed. It sounded nice. So we are QMed Knowledge Foundation. And over the last 18 years, we focused on training right from undergrad medical, dental, pharma, physiotherapy, nursing, all kinds of students, right up to seniors. I've even had vice chancellors, deans attend my workshops. So we teach them the skills of step by step, correct, structured online searching. And also, as an addendum, the use of technology in writing references without wasting time. So overall today, what we achieve is not only we save them lots and lots of time, the time which they can give themselves, the time which they can give patients, the time which they can give for more research, etc. But very importantly, this part is the foundation of any research, and which means contribution back to public health. So we believe that we are doing a lot to improve healthcare, one of the components of entire healthcare. We are working very heavily on that, and that has been neglected. Our aim is to see that this gets into the curriculum and everybody learns it right from their undergraduate days. So that's where we are today and putting in our best efforts.
You have been uh, decorated, you've received two awards. You also won the Lifetime Achievement Award last year and an
Yes,
international award in 2013. So,
that's right.
what you did has been now recognized globally. And tell us a little bit about that. How does it feel to be a change maker at the international level?
Yeah, so when I started, I just thought I'm using my skill and I'm going to be a freelancer away from pressures of jobs and things like that. I don't think I ever thought of becoming a change maker or something like that. But yeah, down the line, people kept mentioning things like that, and I just plodded along, kept doing what I felt I was good at. So the first award came in 2013. And one fine day, I got a mail from a librarian in Seattle. Her name is Anne Glusker. She and I happened to be participants of a pre conference workshop together in 2012. This is the Medical Library Association's annual conference in the US. I have been fortunate to attend this about two, three times and learned a lot of my stuff from there. So when we attended that event and we sat next to each other and chatted, and she was very fascinated with the work I did. So when this award got announced, she said, I want to nominate you. Are you ready? So I said, why not if somebody wants to? And then she asked me to give her a whole lot of facts about myself, which I did. She nominated me, and some days later, I got this mail, congratulations, you've been selected for this. Once she nominated, I had forgotten about it. And when this came, it was, okay. And it was an email. So it took some time to sink in. And then I told people. And when I posted it on social media, I got a huge flood of congrats for it. That's when I thought, okay, this is something good. But the next thing that happened was the actual award ceremony at the next MLA conference. And it was such a grand event, almost like the Nobel Prize kind of big ceremony in a huge hall filled with people, and on stage all award winners, everything in precision. So when they read out the citation, I thought, oh my God, have I really done all that? So that was a very, very lovely feeling. And then again, last year, 2024, which is about 11 years later, I happened to come back from a workshop related trip. And just as I landed, and when they said you can switch on your phones, I put on my data and I saw this message from a well known librarian in India, Dr. Konod, a retired person. He said, I'd like to speak with you. Please call when free. So I thought he's probably inviting me for some event, which is the norm. So I got into my car after coming out of the airport and called him. And he said, you know what, we've chosen you for this Lifetime Achievement Award. And it's called the Dr. S.R. Ranganathan Lifetime Achievement Award. It took me a few seconds to process this because, all of us, when we study in school, college, we come across famous names and we think of them as some majorly glorified people. So Dr. S.R. Ranganathan is the father of library sciences in India, but known world over. And when we studied, he was the aha person for us all the time. So suddenly, and I always thought I must do for the profession what he did because he was actually a mathematician And then he was the one instrumental in changing libraries from just a storehouse of books which were kept under lock and key to seeing that they were used completely. He came up with something called the 5 laws of library science, for which the first law is books are for use. So he used to say, I want to see all the books out of the shelf, that kind of thing. So I said I should also work in those lines, promoting librarians and the profession. So I suppose I've been working at it, but when this award came, I said, that is something I've got to really digest, an award in his name. And then the award ceremony was held in a library conference again in India. And because this organization that gave the award is based in Bangalore, they did a ceremony which was typically based there, and with a traditional headgear and garlands and things like that. So that was again a very wonderful moment. And an interesting thing was when I was flying back at the airport, security that day, it was not at all crowded. I had this bag with my awards and this topi kind of thing which they had put on. So the security lady just opened it out of curiosity and she took it out. Lifetime Achievement Award, congrats, ma'am, and she gave it, which is very unusual interaction with security people. So those were some small, lovely movements along with that.
Wonderful. I like the way you said you identified what you were good at early on. That is, you
Yes.
were good at search, and then you were able to, uh, you were not sort of fighting anything. You couldn't be a doctor. You went along with the flow, and then you found something. So, is this how you trained yourself to deal with, the disappointments of not being able to achieve those aspirations? So, what was that your inner work that brought you to this point of being calm, accepting, and so positive and constructive in the paths you took forward? I'm very curious to for you to unpack that for us.
Oh, no. I think when I put it across, it sounds like I've been a perfect person, but no, I have had my share of frustration and anger and things like that. And if I look back, I know that when I was a homemaker, there were times I would be thinking, is this what my life is going to be all about? I'm really not sure. And I must have taken it out on others at different points without realizing that this is what is making me frustrated and all that. But the times when I got opportunities to do something, I would excitedly put in my best, which happened when I was teaching, which even happened when I did the 1 month of a telephone operator's job. I had actually done a personal secretary course then, and this gap came. They needed a leave vacancy, took me in. But I realized that without even consciously thinking, I put in my best because this was a company, and the person who hired me was the HR manager who used to be my father in law's colleague earlier. 4 years later, when he came to visit, he said, people are asking me even now why I let that lady go. So, that kind of a thing. I
So,
think
doing
putting
your
in
best, I think.
doing my best was probably something built in all the time, and helping people and teaching our skills and qualities deep inside. Later, as I said, I did go through feelings. My brothers were allowed to study, I wasn't. That's gender equality, inequality, and all that. But then there were times I used to tell myself, if you had to do that, you should have fought it out. You shouldn't have just accepted it. But the changes which happened were after reading excellent books like Stephen Covey, Robin Sharma, all those. And then I did Art of Living. I know all spiritual courses are good in their own ways. I happened to do Art of Living after my mother passed away when I wasn't able to cope with that. And as I did more courses, I realized how each of us is responsible for what we do. We cannot blame anybody else. And I know there are girls who have fought system. I mean, we know people generations ago who fought the system like Rani Lakshmibai and did what they had to. So I said, I really shouldn't blame anyone else. Henceforth, it's what I do best. So That's what makes me go further.
So this, you also use the word help a couple of times. So this attitude of serving, which is also what I think the search does. So when we learn to search, we are also helping ourselves to become independent in finding that. So this part of search today with Google, with AI which is your strong forte, is now become available to everybody. There are search engines and there is automation. So, where does that leave the relevance of library science, of your trust, if you can tell us that?
Definitely, because it's a question I get every day now. So it's like this: a library, the internet, the AI, they are all things to access. Okay. Now, long ago, library access was there only if you were part of an institution. So you had access to those books, journals, etc. Internet came, you had access to anything if you could pay for it. Then things started changing little by little. Today, AI, yes, you have a free version, you have the paid version. But what everybody needs to remember is, let's say, the first time or even any time you went into a library, the collection, if it's a college or university, it is huge. How many people really know how to exploit that collection for themselves unless there is an excellent librarian and library staff who go on helping them? Translate that to the internet, that's like a million libraries. Today, you can, in fact, I usually portray a scene where somebody is trying to drink water that is dripping from a slow tap, which is what it was earlier. And today, when they ask for water, they have the whole ocean trying to drown them in a tsunami. How do you handle that? There are two extreme ends of challenges. But just because people get something and can make do with that, they believe they have everything.
Hmm.
AI, it gives wonderful answers, no question. And I have full faith in the power of AI. But it also means one has to know, if you're going to one specific AI tool, what all does it offer, what all does it not offer, and how do you ask the right questions to get the best answers. Technically, that's called prompts. But asking the right questions for us librarians is training in which is inbuilt in us right from the day we were trained into something called providing reference services. So we learned that the more specific the question was, or the person gave us the right context, we could help them better. This is all just translated to a lot more complexity with the internet, search engines, proper databases, and now the AI. So, unless people learn all these better and better, I'm sometimes a little scared that the quality of research and all that might go down because people are conveniently accepting that AI does everything very well, and it has the potential, no question, but it needs the right knowledge base. First thing, as of today, AI cannot search the paid sources. It only searches the free sources. And then it has to interpret questions that you're asking correctly and so much more. I'm sure technology will do all of that. And it might do it even tomorrow. But people should know how to understand, interpret, and use it, right? I believe that we will move more towards that. Telling them that, say, from there's a database called PubMed, which I do my major training on. If you know all these nuances of PubMed, you will ask AI how to do your search better because you'll tell it, I want these words combined, I want this way, and that way.
I think also the fearlessness of technology, Vasu, has probably held you in good stead. Was that something that uh, you had to fight to get over? Did you have experience any biases, either or self-talk, which was like, I don't know this, or I need someone to help me with this?
Right. So when we got the first computer at home, my children were, of course, most, they were wanting to use it. And I said, only when daddy's here, you're going to touch it. And then, of course, within few days, they mastered the game. So they said, we know how to use it. I used to be very scared saying what, because I used to hear stories of how data vanished those days. You pressed the wrong button and stuff. But then gradually, the first thing was my son taught me using a pen and paper how one game worked. And then he showed me how to use it. That was the starting point. After that, in the first library I worked in, which was the Indian Institute of Geomagnetism, when I started applying using computers to my profession, all barriers broke. And then I started, we used a library software. We were the first library in Mumbai to use that. So gradually the vendor asked, some people want to see it. Can they come there and see it? Because they were based in Pune. So I used to give demos of that, things like that. So gradually learned. And then after that, it was nothing, learning it. And till today, I'm constantly learning something new, not just technology, but even in the information resources. So, for example, a most recent course I did online was how to peer review search strategies. Somebody else does a search, how do we peer review that correctly? And that was a 6 hour long course. Very, very interesting.
So you're a learner and you're a teacher.
Yes, definitely. Lifelong learner. I would like to add, last couple of years, I've been going through a mentorship uh, program. And interestingly, I also help the mentor teach some of the newer people who come in skills like mind mapping and all that, which he taught me. So he's somebody who constantly says that you cannot let fear overcome anything. You have to keep on learning, there's no question. And AI is something you've got to see how best you will utilize in anything at all. So many things like this. And in fact, I would say whenever I'm low, and the day I attend his session with either I'm teaching or learning or both, end of it, I come out all charged all over again.
And what is the future of QMed, the trust?
Yeah. So interestingly, when we set up a trust 18 years ago and had the inaugural thing, I had said we aim to become redundant, because at least in its current form of teaching how to search. Now we've created e-learning courses on a site called www.qmedcourses.in, and we've recorded our videos. There are assessments that people can do and learn and all that. This is something which I really consider is a gift for the whole country, but I need the support of the National Medical Commission and others to say that everybody has to learn this. And then, if you divide it by the number of institutions in the country, we could really work out something by which each institution pays a nominal amount, and we have all the money as a trust to run our operations. And then I can keep recording more courses, putting them on as long as is necessary. Let's say I'm always prepared. AI will completely wipe us out. But till that day, everybody learns all this and they still learn how to give the best prompts, things like that. Our day is done. But if other opportunities come up, take them and do as much. Of course, one thing I really need to find is the succession planning, how somebody else would take it on. And for that, the challenge is today I we always struggle with the funding that is needed. So I can't find another mad person like me who will do it with, minimal resources. I need to find somebody who's eager enough to take it on and do it. But that's where, if the country, the health professions really take it up and do something, it will make a very big difference. So we are looking out at all possible channels to see how we sustain this. And any good thing that happens, my team and I take it as that's a positive sign from the universe. Maybe we can plod ahead. while we are all the
Wonderful.
time ready with the plan B of if we have to shut it down, what all do we cancel and do things. So we every day it's a left brain, right brain balance act that we are doing.
It was great talking to you, Vasu. I think the people would have really discovered how a quest for excellence takes a person, and there are no limits to what we can achieve and how we can add value to ourselves and to others. So, thank you very much for being a guest on this podcast. And
My pleasure. And if I could just add one line at the end, I'd really love to say I'd like the whole country to take the library and information sciences profession more seriously and see how it can be really revamped. And there are international standards, and we can go even higher than that. We could maybe evolve into a new profession also, which combines both. But that's something which is serious food for thought, because in India, we have the population, the intelligence, the language diversity, everything to combine all these together to create a lot of new good technology, AI related stuff. So that's a message that I'd love to share with our viewers. Thank you
thank
so
you.
much, Deepa. It was wonderful participating here.
Thank you very much. Good luck.
Thank you.